Well, if that were so, we wouldn't have to be here wondering what's going on in the future, right? But good afternoon. It is my pleasure to be up here to do this duty. Among the noted changes in healthcare today are the new and innovative ways care is being delivered to our patients. Our next session is entitled Innovations and Best Practices in Healthcare Delivery, featuring a panel discussion that will be led off by our featured speaker, Rick Cameron with Navigant Healthcare. Now, Rick did email me and said that in the interest of brevity of time, I could sort of shorten his CV, but I never met a microphone I didn't like, and I love the sound of my voice, so I'm going to give you the full Monty on Rick. Rick Cameron is the managing director of the healthcare practice with areas of expertise in operations and corporate and business unit strategy. With more than 35 years of experience in the hospital group, in the hospital and group practice, managed care, and healthcare consulting arenas, Rick uses his background to provide his clients with a full range of physician-focused management and consulting services with an emphasis on practice operations and financial performance, assessment and improvement, compensation design, assessment and implementation, physician-hospital relationship development, assessment and implementation, and strategic business planning and management development. If that's not enough, that he's just about ready to cure world peace, we'll go on. He has extensive experience working with national and regional health systems, hospitals, hospital-employed and independent physician groups, law firms, and other consulting firms across the country. Mr. Cameron earned his BS at Oakland University and his MHSA at the University of Michigan. So without any further ado, please welcome Rick Cameron.
Good afternoon, everybody. And I think Dr. Zeltzer just added another definition for what you do with Xanax in terms of the length of time he spent with my bio. I appreciate that very much. As was noted in our afternoon today, our session is going to cover innovation in healthcare delivery, sort of at a national level with a national view, and more importantly, a deeper dive into what's been occurring in innovation here in Palm Beach County. So I'm going to speak for about 5 minutes at a national level, and then I'm going to have our panelists come up, and each panelist is going to spend up to 10 minutes, and no more than 10 minutes, talking about their own innovation initiatives and activities so that we can lay some foundation for what's been going on in Palm Beach County. And then we're going to leave enough time at the end for questions and answers with the panel and as well as with our audience, all of you. So with that as a sort of a backdrop, I'm going to try to make this pointer work. Let's see, this works great. Okay, so I thought we'd start with a real quick notion of what do we mean by innovation. And what I found interesting in looking at this was the synonyms are more revealing than you might think, because innovation can mean a lot of different things depending upon your perspective. It can certainly be an alternative or a change. It can also be a revolution. It can be a breakthrough. It can also be a transformation or an upheaval. I think we all know that in healthcare in general, there's plenty of activities and examples around the country where different people at different times probably don't even think of innovation as the word describing what just hit their desk or what they've just been asked to do, but it's in fact one of these other words. I also think that innovation may best be thought of as a range of translations, so to speak. So this slide just simply shows that if you have what's called a core innovation, it tends to be one in which you've taken your existing business and your existing customer base and you've done something there. The next level up is adjacent, where you've kept your current business but you've expanded into a new market or a new activity. And the third is transformation, where you've actually gone out and you've actually broken ground in a brand new way with your business, as well as perhaps in a space that has never been addressed before. So as you think about, and as you listen to what I'm going to say in the next couple of minutes about some of the other examples of innovation from around the country, think of this also in terms of what our panelists will talk about in a little bit, and use your own translation of where you think the types of innovation that you are hearing and describing fit along this continuum. So innovation in healthcare is really not a new concept. Innovation, in fact, the circumstances around how we do what we do, providing care to patients, has always been a dynamic in the almost 40 years that I've been in business, especially. But I do think quality as an innovation is an important thing to touch about just for a little bit. Intermountain Healthcare in Utah is a world leader in the field of quality being an effect of the entire organization. And yes, they're willing to take less revenue in their primary business here to provide the highest quality possible. Now, it helps in their case that they also have a health plan, so they're able to take on as much risk as they could and can. But the point here is that organizations are actually looking at quality as an opportunity, and certainly not as something they just begrudgingly have to deal with. Outsourcing as an innovation has been around for quite a while. There are some examples here of how hospitals and others have taken what they've normally done within their four walls and brought in other companies and other ways to get that particular work done. We also have population health as innovation. This was mentioned this morning a couple times around the notion that we're now in a in a population health dynamic, and yet at the same time, we were here once before a few decades ago, and there's some naysayers out there. I think Dr. Goldsmith was one. My good friend Nate Kaufman's another one, where we have to be very careful about how we approach this notion of population health and don't repeat the mistakes of the past. Healthcare has a great forum, if you will, for innovation that's everywhere today. So, for example, who would have thought a few years ago that at least a quarter, if not more, of the physicians in this country had the ability to let their patient have access to their electronic information by themselves? In the old days, it was in the patient record, and in the old days, you had to ask a lot and do a lot to try to get that information out of the record. No longer the case and growing. Over half of the hospitals in the U.S. have an electronic health record of some type, and more are growing every day. And that's something, again, that I think from an innovation perspective is pretty significant. I wanted to also point out a care application innovation example for you. It's 0%, 0%. Oakwood Hospital in Dearborn, Michigan, a few years ago, pioneered an effort to reduce the amount of elective C-sections and inductions in patients at their hospital. And the reason they did that is they saw an increasing number of very young babies being born and having complications, requiring ICU time and other implications. So they put a hard stop in back in 2011, and the result of that has been adoption across the state of Michigan of this particular standard, which has done a significant job to reduce the number of early elective deliveries and utilization of the ICUs in the state. Now, if you're a hospital person and or neonatologist or other sort of IS, and you're looking at the return on investment of the renew in your NICU, if you will, this is not necessarily a good thing, but it's the right thing to do, in my view. There's several innovations through the famous Accountable Care Act. I've just got two quick ones up here for you. One is called Hospital at Home. This is Presbyterian in Albuquerque. They actually have started a project last year where for patients with certain diagnoses, they will actually set up a hospital room in your home, bring all the equipment to that home, have staff, including doctors, come and take care of the patient in home, and as a result, reducing not only the cost of care, but also reducing infection rates and other sorts of things. It's their way of attempting to get at innovation in terms of why do everybody have to be in the hospital for certain types of illnesses. The second one is what's called a microclinic. And this is, again, very new and just getting through some beta testing. It's getting some vendor funding right now. But basically, envision a small space that a patient can go into, and because the space is set up so that it has telephonic telecommunication capability and equipment in it that allows the patient to actually have more than a blood pressure test done. And when those tests are completed, the machines will self-clean themselves so that they can be able for the next patient with no labor involved. That's a very innovative activity in my view. And the key here is that, again, it gets at that whole question of how are we going to use technology and access to technology in a way that's uniquely special for based on what we've seen in the past. The last couple of slides for me, ECOs have been discussed quite a bit today, and some quick examples. We have some more ECO discussions to come with our panel. Medicare ECO numbers have grown quite a bit, as you can see, and reported pretty significant savings last year. What's not on the slide is that only 1 in 6 ACOs actually made money last year. The other 5 of 6 didn't. So there still is a ways to go to figure out how to make the ACO model work really well for more than just a handful. Medicaid program, their states have increased the number of Medicaid ACOs that are in existence today. Colorado's the largest. Utah just started their program, and they have a big aspirational goal, as you can see there, to save about almost $3 billion over 7 years, which is a pretty significant objective. There's also a large number of commercial ACOs out there. These are organized by insurance companies, not Medicare and Medicaid, and they are making significant, documenting significant improvements as well. And then last here is what's the future look like for ACOs. There's a whole raft of, this is a list that's probably about 2 months old, but a whole list of specialty-specific ACOs, I might call them, as you can see there, that are being contemplated and being organized to deliver improved quality of care at lower costs, and again, using their own dynamic to change the way that healthcare is provided. So those are my quick initial comments relative to our panel activity and this notion of innovation. I'd like to have the panel come up, please. I see, here we go, 1, 2, 3. While my panel is coming up, I will make a quick introduction of each of them. Sit anywhere you like. Please allow me to introduce my fellow panelists. I have Kelly Conroy of the AAA Group, to my left. I have Dr. Jose Orozcoe leading the Palm Beach County Medical Society's AAA initiative on her left. I have Heather Miller Siegel, an attorney with Broad and Castle, to my right. I have Dr. James Goldenberg, medical specialist of the Palm Beaches, on her right. And last but not least, Dr. Ken Homer with Holy Cross Physician Partners. Please be sure to read their complete bios in your program. As I mentioned when I started my comments, each panelist will have up to 10 minutes, and if you can give us less than 10 minutes, that would be tremendous, to describe your innovation through some slides that we have from each of them. And then after that, we will go through Q&A with panelists and with all of you. So I want you to be thinking about questions that you would like to ask our panel as we conclude this particular portion of our activity today. With that, I'm going to turn it over to Kelly.